Welcome to InfoT. Today we will talk about a controversial subject, autism. What is autism? For our video, we consulted the renowned manual, the Diagnostic and Statistical Manual of Mental Disorders, or DSM-5 for short. DSM-5 is a standard manual that healthcare practitioners use to diagnose several conditions, including autism. The latest edition was published in 2013, and it included many significant changes in quite a few conditions, including the autism spectrum disorder. The DSM-5 is widely used in the USA. According to the DSM-5, there are 5 main criteria that need to be met by an individual in order to get a diagnosis of the autism spectrum disorder, or ASD for short. Let's see the first criteria. There need to be persistent deficits in social interaction and communication in multiple contexts, such as in home, school, etc. These deficits could be about social-emotional reciprocity or a reduced sharing of interests, emotion, and affect. It could mean a failure to respond to social interactions as well. Non-verbal communication, difficulty maintaining eye contact, understanding body language and gestures, lack of facial expressions, difficulty developing and maintaining relationships, difficulty making friends and having a spouse are some examples of these deficits. The second criteria is about the restricted, repetitive behaviors, interests or activities that the person now has or used to have when younger. These behaviors could refer to repetitive motor movements and a stereotyped use of objects or speech. For example, this could be simple motor stereotypies, lining up toys or flipping objects, echolalia, idiosyncratic phrases. It could also mean that the person has a strong desire for sameness, has limited or no flexibility to change of routines. They could have difficulty with transition, show distress at small changes, and have limited dietary options. They could have highly restricted, fixated interests that are abnormal in intensity or focus. For example, an obsession with the planets in the universe that keeps the person from discussing any other subject. People with ASD tend to have hyper or hyporeactivity to sensory stimuli. They may need to smell or touch things constantly, have an adverse response to specific sounds or textures, become really fascinated with lights and movement. Third criteria. Symptoms must be present in the early developmental period. Usually symptoms are recognized at around 12 to 24 months of age, but some individuals with severe developmental delays express these symptoms before their first birthday. Criteria number 4. All the aforementioned symptoms do cause a significant impairment in social, occupational, or other important areas of functioning. And last criteria, these symptoms cannot be better explained by an intellectual disability or a global developmental delay. There are 3 levels of severity in ASD, depending on the level of support and individual needs, ranging from level 1 with the least support needed to level 3 with the most support needed. So, what does it look like? At around 12 to 24 months of age, the first symptoms of autism spectrum disorder arise. Usually the child shows signs of delayed language development, a lack of social interest, odd play patterns, and unusual communication patterns. For example, they could count up to 100 but fail to respond to their name. They could carry around their favorite toy but never play with it, lack eye contact, etc. After the second year of life, symptoms become more apparent, with an excess of repetitive behaviors and lack of typical play. At around 3 to 5 years old, most children are diagnosed and are involved in an intervention. Most children with ASD have difficulties in their early life, but with appropriate therapy they improve during adolescence. Each person is different, and each person with ASD is different. If you want to better understand autism, do read books written by autistic people where they describe how they're experiencing ASD symptoms and the effect it can have on their lives. Thank you for watching InfoT. If you like this video, feel free to like and subscribe. Stay tuned for more.